Thank you. Actually, I borrowed these slides a few years ago when we did our first boot camp about, I think, 7, 8 years ago from our friends in SNS. Um, and this is basically, although meant for first year residents, but obviously it's meant for everybody. And I think we need to keep revising. Um, there are things that you generally have in yourself, and there are things that are instilled into you. So those things that are instilled into you, those are very important when you want to become a neurosurgeon or any kind of a physician or any person in the society interacting with normal people. So professionalism, what is it? It defines, for example, neurosurgery. So a neurosurgeon has to be highly educated. So all of you have to be thinking about it, that this is what I need to become. Highly educated, impressive, competence. So competence is very, very important. Anything you do, you have to do the best for the patient. Because a small mistake that you make can cause serious problems to that patient. Just if somebody calls you and you have to go somewhere and see a patient and you want to lie down another 20 minutes, and those 20 minutes could be vital for that patient. So all these things, simple things, competence is very important. So whatever you do with competency. Autonomy, it's important that you're able to make decisions on your own. Nobody forces you, and you have to be strong enough and build yourself, have knowledge. So for that, you need to have passion behind you, and neurosurgery is all about passion. If you want to do it, you have to dedicate your life to it. It's not that you want to give up everything else, but at the same time, you need to have a balance. But when you are in training, you have to have all this. You have to have a comfortable salary. If you don't have a comfortable salary, you can't concentrate. I think this is an essential part as well. Um, you need to be creative. If I tell you to go and do something, think about it. Why am I doing it? Why can't I do it some other way? And if you think you can, just talk to the boss. So all my residents know, anytime I'm doing a case, I ask them, what do you think I should do here? And if they tell me we can do it this way, and if I think they're right, I would go that way. So that's the way to do it. You have to learn from each other. And this is, you have a case tomorrow, you have to read up. Every case that's next day, you have to read up. You know that you have to prepare some kind of slides. For example, you have an anatomy session. You have to read up well, because you'll be teaching and people will be asking you questions, and you need to be aware of everything. Nowadays, it's so easy. Those atlases, you don't have to go and search in front of a computer. You don't have to sit for hours. You have all these beautiful 3D images on anatomy. So it's very, very important that you think intellectually, become creative, trust, being truthful. There is nothing else. If one thing you have to instill in yourself is being truthful. You have to be truthful to your seniors, juniors, your patients, everybody that you come in contact. If you make a mistake, you have to be truthful. If something goes wrong, you have to be truthful. And people should be able to trust you for this. And they should vouch that, yeah, this person will never harm any person. And you should have strict ethical and moral standards. And by that, I mean everything that we do. For example, you have to come in here. We're supposed to start at 8 in the morning, we start lectures at 8:30. All this is very, very, very important, because this tells you that you have your ethical standard. There are people who have come from abroad to teach you. They've spent money, time, whatever. So I think all that comes into play. Your personality should be like the best personality you ever know. We all want to become the best. So why not do it? We can do this. It's possible. So this is all professionalism is. Obviously, ethical behavior is very important. We have talked about it. Confidentiality. We can make a fun of a patient who's very fat or obese in front of other patient or whatever. Or if there's something that, they have a diagnosis and they don't want to know, and you're discussing with somebody else, you have got scans that you're showing to the world, and you put their name up there. So you can't do that. So all this has changed. We have to think about that patients' rights are very, very important, and their confidentiality should come first. I'm sorry. I think, when you're a duty not to abandon because of inability to pay. So if somebody can't pay, you can't say your surgery cannot be done. That's not in us. We should be able to offer them whichever we can help them, or guide them any other way that they can be helped. Putting the client's interest ahead of one's own moral compass is very important. It's morally, we have to be very strong. So people who are chatting, hello. So this all is we are talking about. Put in all our efforts into what you're doing instead of wasting time. I think that is very important. Work ethics and motivation. So if, for example, you know that you can't do a case very well, tell your boss. I need help in this. Come and help me. If you can't, if you have problem reading, if there is some research work that have been given to you and you can't do that properly, tell your boss, ask him for help. But you need to be truthful, and you should be thinking about you need to have motivation. You can't be thinking, oh, you know, if you have got an exam coming up, if you have got something else to do, if you have a lecture to prepare, whatever, all these things are important from neurosurgical perspective. We are not ordinary people. We are cream of the society. If it's not that we are different from others, but we need to change ourselves and be the best. That's the only way we can move forward. We need to have willingness to share in the transmission of professional knowledge and values like we're doing today. So you stand up, you don't get paid for this, but whatever you're doing is kind of sadka jari on the first place. And then the second place, what you're doing is, if you're going to make difference out in the community, that's helpful to everybody. It's for the whole society that we're doing. And positive attitudes towards the profession. Always think positive. Never think, if I'm competing with somebody, I don't have to be positive. We both, two positives can work together and get somewhere instead of being negative to each other. So two residents, we always have competition. It's okay. Have competition, but at the same time, help each other. If there's a lecture to give, help him prepare or her prepare, and, move forward with it. These are obviously the American outcome project, in which we looked at 6 competencies. So we look at patient care, medical knowledge, professionalism, interpersonal and communication skills, system-based practice, practice-based learning and improvement. This we generally do. Medical knowledge, we learn a bit from here, read a bit, come to conferences, workshops like these. This has to be instilled. And this needs to come from your trainers as well as from people around you and your seniors. And they are your, you look at your SR, and that person has to tell you how to go about it and has to be a role model for you. And you need to be a role model for your juniors, for medical students, for interns. So all this is very important. And you need to have some kind of a system-based practice. So for example, I today decide I can do cardiac surgery. Yes, nobody can stop me. But at the same time, am I doing the right thing? Am I trained for it? So you need to have some kind of practice in which, okay, you say that this person can do this thing safely and he should be doing it. On the other hand, some other person may not be allowed to do that because of a particular reason, or they may have less knowledge, less experience, or not aware of new things that are going on. So practice-based learning and improvement. So you look at your own practice and every day try to improve. And this is for every resident. Think about every day what new you have read, what new you're going to instill, what new case you have seen. Go back and read it. It's very, very, very important. So professionalism definition is manifested through or a commitment to carrying out professional responsibilities, adherence to ethical principles, and sensitivity to diverse patient population. So it's for everybody. So you can't say that, okay, this person cannot speak English or cannot speak Urdu, so I'm not going to give him that care. Every patient is equal for you. But these ethical responsibilities and professional responsibilities are as important as the knowledge and the skills that you're trying to get. So it's very, very important. And we need to understand we are not ordinary people. We have been changed the way we have been taught, and you need to instill that. It's very, very, very important. So how do we measure it? There are various ways of measuring it. Throughout US now, they have a 360-degree evaluation. So you need to have evaluation according to your clinical and operative. So you give your feedback to your bosses. Bosses give you feedback. What can you do? What I can give you easily, and what I can't give you. What's happening? How much of knowledge you have? If you read up every case that you go in and operate, you will be able to help the boss in making the right decisions as well. And it has to be done by rotation annually. I was talking to Hassan Sayed about it, and hopefully we should be able to put in all the centers in Pakistan some kind of a system in which all this is monitored and done properly. And we all have to play our part. How is it measured? Obviously, you need to make sure that if there are duty hours, they need to be adhered. So you can't have one person on call 7 days a week. So yeah, there has to be some limitation to it, and you need to document that. You need to see what kind of nursing interaction. So many times you see, somebody complains, a nurse complains that this person did this X, Y, Z, or I was calling and there was no response, blah, blah. All this is important, just not your boss, but everybody in your whole team is important to you. Patients' interactions, most important. How you're going to talk to them. For example, if you went and became a patient somewhere, went somewhere, spoke to somebody, You want to be the best. You don't want to be less than that. If when a patient comes to you, they expect the best from you, because you're not just an ordinary doctor. You're a neurosurgeon, completely different breed. Um, I think demeanor and dress, how we dress up, is important. We need to show that we look like neurosurgeon. That doesn't mean neurosurgeon need to wear shorts and maybe a hat or whatever. Just need to be modest. Devotion to patient care should be there. Ethical decision making always. So you cannot repeat it again and again. This is the most important thing we need to have. And you need to contribute to your profession. So just doing that in your own service and your own community is not good enough. You have to do it for the whole community, for your friends, for your hospital, for your surroundings, your city, your country, or the whole world. So this essence of professionalism is continuous self-improvement. Every day thinking about how I can improve myself. What did I do not good enough? How can I improve that? Lifelong learning and thirst for knowledge should be there. You must read constantly. You must read systematically. You must master the field. You must read throughout your career. All this is essential. You must share your own ideas with professional colleagues by teaching, speaking, and writing. That is the only way your brain is going to be innovative. You need to be thinking how you're going to move forward. And there are bad outcomes. We all have them. There is nobody, we are not humans if we don't make mistakes. So bad outcomes are sometimes unavoidable, and perfection is unobtainable. So these both will happen. There's no doubt about it. So what is expected of you? Your very best effort. You can't do more than your best. We came here this morning, that's the best we can do. But obviously we can't get all the residents to come and sit here. So we can just do the best. And you all can do your best as well. So I think all that's essential. Uh, Honesty, accept your results. Morbidity and mortality tracking, analysis, and reporting. You have to be truthful. Say, okay, this happened. How do we make sure it doesn't happen? How do you make sure all of you do not make that mistake again? Constant striving for improvement, practice-based learning. So you go through and see, okay, we had these cases in which we were not able to do, or this particular person did X, Y, and Z. So how can we make sure that nobody else makes that mistake and that person improves the next time? So all that is essential. We need to care about those who we care for. So we have to care for our patients. So small, simple things matter. And the only way we can do it is being professional. Patient know if you're on their side and if you care about them, what happens to them. When you do, they will forgive you and you will forgive yourself. And there will be times that we all make these mistakes in which we should have done something else. And, if you do all this and they know that you care for them, they will forgive you. So anytime you have a patient, think of them as your own. That is paramount. Honesty, even with patients after an error. Yes, involve your superiors for the experience in sensitive patients communication. So if there's an issue, get your colleagues to help you, get a senior to help you, but always make sure you're on patient's side. That is very important for us. Supervision, the principal basis of supervision, of surgery, supervision and authority, gradual authority and autonomy. Recognition that surgical training is fundamentally different from non-surgical training. We need to understand that you are going to get that everything slowly. You're not going to get first day an aneurysm. You're not going to get first day on a big complex case. That's not going to happen. So how is it different? Close supervision at every training level, attending staff, senior, chief resident. So every level has to be there. And we all will go through that level. Some of you have gone through that. Some of you are on the upper side. Some of you are on the lower side. Whoever, but you have to make sure there's a hierarchy there. Define psychomotor skills for each training levels and a hierarchy. So it has to be like army hierarchy. Same thing. If something is you've been told something and you pass on to somebody else, it must happen. We all have to do our jobs. It's like any other clockwise work. It should happen. So all these wheels have to work for patients to get proper care. So when does supervision apply? In the operating room, for the key portion of the operation, for any portion in which you are not independently competent, for wards until you are specifically cleared for independence, for decision making, anytime you don't know, anytime you are not sure whether you know or not know, then call somebody, pick up the phone. I think do not make decisions in which you won't do the same thing for your family or your friends. Things your supervisor want to know. This is important, and I keep repeating this to my residents. Patient admitted, I'd like to know. If there's a change in the status of a patient, transfer to ICU, any patient is transferred, I want to know. Everybody else wants to know. If somebody needs an operation, anything that will change the OR schedule. Because for whatever reason, some patient ate something, something happened, their heart status, whatever. If there's an angry family, you all need to inform the seniors, or if you are directly involved, you need to make sure you handle that. Anything that you would want to know in the shoes of your bosses. So, if you were there, would you tell your boss or not? So that's what you need to be thinking about. So I hear, I forget, I see and I remember, and I do and I understand. It's a famous Chinese proverb. So a teacher is one who makes himself progressively unnecessary. So that means slowly and gradually they give you so much work that you're able to replace them in that particular case or in that particular surroundings. Um, Supervision and hierarchy, how they're related, acquisition of competence, cognition, procedural, graduated economy. Experience is the best teacher. So we have been after the college to change the duration of neurosurgery. The whole thing is that total experience at the moment you guys are getting is too less to become an independent neurosurgeon and confident. Ethical behavior, uncompromising excellence in patient care. So that you have to be completely uncompromising. Fatigue, it's not good for patient safety, for quality, and for your own health. And it's important, if there's a thing, you go and tell your bosses. So yeah, there should be compliance. So in US, for example, they have an 80 hours week, 1 in 7 days off, average 4 weeks, 8 hours minimum shift, direct or on-site supervision. So there are seniors, residents, or faculty. Quality, self-monitoring, ask for help. Don't drive tired. So if you're tired, don't go home driving. So I think it's important that, ask for help. If you can get sleep, get it at home. Patient's hands-off is there. So if teamwork approach shortens shifts, transfer of knowledge and responsibility is chance for dangerous errors and poor outcome. What to do? Keep list of key information issues. Leave time for orders, careful handovers at each shift change without distraction. And it is important. You need to be, when you're transferring, when you're leaving and you're transferring to somebody else, all this is important. Take your time. Spend time with them. You cannot do it on the phone. You cannot do it just, yeah, this is a piece of paper, take it and I'm leaving. You have to sit down and talk to them. And it's important that electronic medical record has to be properly, wherever you have it, has to be properly documented. Pearls, it's a long road. It is hard. There is no doubt. Neurosurgery is not an easy field. There's a lot of efforts required. If you don't enjoy the process, it may be difficult to finish it. So some people don't finish it. It's okay. It's fine. They can do something else. Hard work without talent is a shame, but talent without hard work is a tragedy. Goodness without knowledge is weak. Knowledge without goodness is dangerous. What do we mean? You're all smart and talented. That's what we're saying. We are asking for diligence and humanity. There is nothing more than that. That's all you need to do. You're about to enter the most exciting profession in the world. How did you come to decide to be a neurosurgeon? Every neurosurgeon has a story why they became a neurosurgeon. Ask your peers to tell you their stories, and you'll realize where you're going. Neurosurgeon surgery is a community, chief and program, mentors, colleagues, patients, community, family. They all come in, and they all need to work together to get somewhere. Ask yourself these questions. How many people enjoy what they do every day? How many people feel that they are making a positive contribution to the lives of other humans every day? Ask a neurosurgeon these questions. The answer will be stereotypical. Almost no neurosurgeon regrets their decision in becoming a neurosurgeon. So we are a completely different community. Unfortunately, we don't have a long program. We have a short program at the moment, but hopefully neurosurgery will be a 5-year program from next July. So, all these rotations are there. Not going to go into what, this is important. If you're trying to train a concert pianist, needs 10,000 hours. So you can imagine the total number of hours those guys are doing during this time. 6-year program is 11,520 hours. So in 6-year program, it's equal to an expert pianist. Rest when you can rest, you look better, you learn better, you will stay healthier. Take care of yourself, do spend time away from the hospital, be with your family, keep physically active. But this slide comes last, as you can see. Don't be afraid to ask. Silence is often mistaken for understanding. Ask seniors when you don't know. It's okay to say, I don't know. So there is no, yes, or I don't know. There's nothing in between. Particularly to patients, don't provide wrong information. Most of all, remember that sometimes you don't know when you don't know. So prioritize things. Who are the sick patients? Think about hands-on, go back, re-examine them, prioritize their care. Stay organized, keep a list to yourself, be practical. Brain surgery is really just common sense. Prepare for cases. Operating in a protected environment, learning environment is precious and extraordinary privilege. Be rested. Ready, read all about the disease. Study, understand the goals of operation. Meet the patient if you can. It's essential because you remember that patient, and if in future you'll be independent as well. You'll be seeing this patient on your own. Accurate and timely communication up and down the chain of command is critical. So there is no other way than have a proper communication. So yes, no, or I don't know. Think before you speak, don't speculate. Nothing substitutes for seeing the patient yourself repeatedly if indicated. Experience is critical and precious. Always listen. You're not expected to know everything, but you're expected to learn. Always keep your composure. Avoid becoming argumentative with your superiors, peers, or others. Education, ultimately, your success depends upon your willingness to share knowledge. Think about it, teach, think how you can improve. Positive professional relationship will allow you to excel and help your patients. Don't come with problems, come with solutions. Neurosurgery is defined by the need and the ability to get it done. The buck stops with you. So take one day at a time. Better is possible. It does not take genius. It takes diligence. It takes moral clarity. It takes ingenuity. Above all, it takes a willingness to try. Thank you.